Welcome everyone. We begin with a major threat to street children, drug and chemical abuse. The journal Addiction reviewed 50 studies conducted in 22 countries. Researchers say about 50% of street children in low-income countries use inhalants, predominantly glue and paint thinner. In high-income countries, injection drugs are more popular, including heroin. Street children also use alcohol, tobacco, and marijuana. One researcher calls the study a wake-up call for policymakers, international NGOs, the World Health Organization, and UNICEF. And the United Nations AIDS program says Malawi is amongst 7 countries in sub-Saharan Africa which have cut the number of new HIV infections in children by 50% since 2009.
Lexina Lungu came to this health center in Kaungu today for an antenatal checkup. The center is located 130 kilometers north of Malawi's capital, Lilongwe. Lungu is 36 weeks pregnant with her second child. She tested positive for HIV when she came for a routine checkup in the early stages of the pregnancy.
I quickly rushed home and told my husband, who also rushed to the hospital, to have his blood tested for HIV as well.
Lungu is now on a treatment plan known as Option B+. It is offered free to expectant mothers in Malawi. The treatment includes a simple one-pill daily program that's easy for health workers to prescribe and for pregnant mothers to follow. Lungu says in the beginning it was difficult for her to accept being HIV positive.
I never expected it. It was too painful. It is still too painful even now, so I accepted to live with it positively.
In 2011, the Malawi government and its partners developed a new treatment strategy to prevent the next generation of children born to HIV-positive mothers from being infected. Observers say access to treatment to prevent mother-to-child transmission has improved in the country. UNAIDS says reductions have also been observed in Botswana, Ethiopia, Ghana, Namibia, South Africa, and Zambia.
In 2009, there were over 450,000 children born infected with HIV. In 2010, that figure's come down to 330,000 globally. So that's a remarkable achievement, but there's more that needs to be done.
Despite the progress, UNAIDS remains concerned because in Angola and Nigeria, new infections in children have increased and remained unchanged, respectively, since 2009.
And that's all for our Africa Health Network today. For more health news and development, be sure to visit our website, africahealthnetwork.com.